Other agencies for diagnosis. For a more precise diagnosis as to the presence of stone and of dilatation and the position of ureteral obstruction, we employ the X-ray, the wax-tipped catheter, and pyelography. Differential diagnosis. Diagnosis of the renal infection is readily made with such precision that the question of differential diagnosis only arises in reference to the coexistence of other conditions, such as stone, page 392, tumor, tuberculosis, page 423, or infections elsewhere in the body. It must not be forgotten that a renal infection does not exclude an infection elsewhere. A tuberculous kidney is apparently proof against pyogenic infection from other organisms, but the opposite kidney to a tubercular kidney may be thus infected. The coexistence of tumor and infection is rare, excepting in the case of old calculus infections, which occasionally lead to carcinoma. Prognosis. The prognosis of the various types of renal infection has been described with sufficient accuracy in giving the clinical picture. We may once again insist upon the need of immediate operation in the treatment of fulminating acute infection and of perinephritic abscess. One must also remember that not only may a pyelonephritis remain entirely latent for years, but also a more severe inflammation, even though it show a definite amount of albumin and pus in plenty, has a relatively good prognosis in that it may continue for many years without destroying life, if only no intercurrent retention or other complications occur.